Hi, my name is Michelle Henry. I'm with the University of Texas at Arlington School of Nursing, and today I will be lecturing on the bisphosphonate medication alondrate, or also known as Fosamax, for osteoporosis and postmenopausal women. This 2-hour lecture is for BSN students in a classroom setting. The ages and education level are varied between 18 years to retirement. There are first-time students as well as students with previous degrees and work experience. So let's start off with talking about what we want to learn in this lecture and go over the objectives. By the end of this lecture, BSN students will be able to, 1, explain 2 physiological ways that Fosamax treats osteoporosis. 2, describe 2 patient education factors regarding the administration of Fosamax. And 3, list 2 contraindications of Fosamax. So let's first start off talking about the disease background. Osteoporosis in postmenopausal women causes their bones to become weak, brittle, causing fractures of the hip, wrist, and spine. Approximately 1.5 million women in the United States have fractures a year caused by osteoporosis, and this can lead to poor quality of life and chronic pain. After a woman has reached menopause, estrogen levels decline, putting them at a high risk for decreased bone mineral density and fragility. Usually there are no signs and symptoms of early bone loss. However, as the disease progresses, women may experience back pain, loss of height, or a fracture that may occur much more easily than it should have. Treatment options are aimed at strengthening bone density by medications, diet, exercise, and other lifestyle choices. So to understand how osteoporosis happens, let's discuss the physiology of the body. As we grow, our bones are in a constant state of renewal, building and breaking down bone. This normal physiology is called bone remodeling, where the body uses osteoclasts to break down bone through resorption and osteoblasts to build new bone through mineralization deposits. Osteoporosis occurs when this homeostasis is altered, and resorption happens faster than the building of new bone, leading to decreased bone mineral density and fragility. After menopause, the estrogen excreted by the ovaries declines, resulting in decreased bone matrix and decreased calcium and phosphate in the bones. So now I would like to talk about a medication that is very commonly used to treat osteoporosis. And this is in the drug class called bisphosphonates, and the medication is called alendronate, or also known as Fosamax, which I will refer to for the remainder of this lecture. Now, bisphosphonates are the very first choice of therapy to start off treating osteoporosis. For their mode of action, bisphosphonates inhibit osteoclast activity of resorption, thereby stopping the breaking down of bone and allowing osteoblasts more time to build bone. The expected outcome of Fosamax is to prevent further bone breakdown and promote bone remodeling. So some things to know about Fosamax. It is an oral medication. It's given daily or weekly, every morning with 6 to 8 ounces of water on an empty stomach. The patient must remain upright for 30 minutes to optimize the health benefits and decrease the GI side effects of nausea, dyspepsia, or abdominal pain. This medication is safe. It is approved by the FDA. However, there are 2 major side effects of this medication that the patient should know about, and that is an atypical femur fracture and osteonecrosis of the jaw. The medication has been proven to be effective in a random control trial involving postmenopausal women with low bone density. The rate of spine and hip fractures was significantly lower by 50%, and the rate of non-spine fractures was lower by 20%. As far as contraindications goes, Fosamax should not be given with calcium, antacids, or iron because it interferes with absorption. It should also not be given with aspirin or NSAIDs because it can interact with Fosamax, leading to further GI upset. Prevention, modification, and restoration of lifestyle includes strategies to prevent future fractures and strengthen bone density. Bisphosphonates, such as Fosamax, prevent osteoporosis by halting further breakdown of bone, thereby allowing the body time to rebuild bone mass and increase bone matrix. Women have to modify their lifestyle choices if they do choose to go on Fosamax, since it needs to be administered on an empty stomach, and they will have to remain upright for 30 minutes afterwards. Lastly, women should also be educated on the benefits of weight-bearing exercises and intake of calcium and vitamin D in conjunction with taking Fosamax to optimize their health benefits. So now let's go over the main points of the lecture and link them back to the objectives that we discussed earlier. By the end of this lecture, BSN students will be able to, 1, explain 2 physiological ways that Fosamax treats osteoporosis. So let's briefly go over the physiology of osteoporosis. Now, in normal physiology, bone remodeling occurs when the osteoclasts break down bone through resorption. Osteoblasts build new bone through mineralization deposits. First, Fosamax will stop this bone breakdown by inhibiting osteoclast activity of resorption. And 2, once the patient is on Fosamax, this will allow the osteoblasts more time to build bone through bone remodeling. Objective number 2, describe 2 patient factors regarding the administration of Fosamax. So Fosamax, as we talked about, is an oral medication. Patients do need to know that it's given daily or weekly, and they need to take it with a 6 to 8 ounce glass of water on an empty stomach. And they also must remain upright for the next 30 minutes to optimize the benefits, as well as to decrease the GI side effects related to it with nausea, dyspepsia, or abdominal pain. And lastly, we want to know the contraindications for Fosamax. So 2 contraindications would include they cannot be given with calcium, antacids, or iron because it interferes with absorption. They should also not be given with aspirin or NSAIDs because that could also lead to further GI upset. So now let's talk about how we will be evaluated after this lecture. After the lecture is done, I would like us to get into a group discussion to reinforce the key learning points. And some of the questions I want us to think about are, 1, how did this lecture increase your knowledge about osteoporosis and Fosamax? 2, describe how the mechanism of action of Fosamax treats osteoporosis. And 3, tell me how you would describe Fosamax to a patient, including drug contraindications, efficacy, and course of treatment. After we're done with the group discussion, we'll go into an activity and we'll work on a case study about osteoporosis. And then after that, we'll take a quick 4-question group quiz. And all of these activities are geared to reinforce the knowledge. Here you guys can ask questions and just go over all the information that we learned today. So this concludes the lecture on osteoporosis and Fosamax. Thank you so much for watching and learning with me today.